Good morning. I'm Kenyon McDuffie, at-large council member and chair of the Council's Committee on Business and Economic Development. Today's Thursday, September 28th, 2023. And we're convening this hearing in person and via Zoom. The time is 10:05 a.m. and I'm calling to order this public hearing. Today, the committee will receive testimony on a few measures. B 25-229, the cost-free coverage for prostate cancer screening amendment act of 2023. Bill 25-183, the Society for Science Real Property Tax Exemption Amendment Act of 2023. Bill 25-428, the Kappa Alpha Psi Fraternity Inc. Real Property Tax Exemption Act of 2023. As a reminder, public witnesses will have 3 minutes to provide testimony and should remember to mute their microphones when they are not speaking. Bill 25-229, the cost-free coverage for prostate cancer screening amendment act of 2023 was introduced by Councilmember Charles Allen and many of my colleagues on March 20th, 2023. The bill was referred to the committee on April 4th of this year. This bill would provide cost-free coverage of one prostate-specific antigen test and digital rectal exam per year pursuant to evidence-based guidelines. It would also prohibit any health insurer from imposing deductible, co-insurance, co-payment, or other cost-sharing requirement for prostate cancer screening. I'm now going to call, before I call panel public witnesses, I want to acknowledge and allow my colleague and introducer to this measure, Charles Allen, to offer any opening remarks. Good morning to you, Councilmember.
Good morning, Chair McDuffie. Thanks so much for holding this important hearing. And thanks for letting me be able to make a quick opening statement. First off, definitely appreciate the hearing on all the measures. I'm going to speak specifically to the cost-free coverage for prostate cancer screening amendment act of 2023. This is also Prostate Cancer Awareness Month, so today's hearing could not be more timely. According to the National Cancer Institute, prostate cancer is the most common type of cancer and the second leading cause of cancer death among men in the United States. The American Cancer Society estimates that there are 3.1 million men currently diagnosed, and there will be an additional 290,000 new cases and 35,000 deaths this year alone. But compared to other states, the district unfortunately ranks at the top in prostate cancer incidence and deaths. Number 1 for prostate cancer deaths and number 6 for prostate cancer incidence. In 2023, it's estimated there will be approximately 540 new cases and 70 deaths here in the District of Columbia. And when we look at who is being diagnosed and dying from prostate cancer, data is clearly indicating there is a huge racial disparity, with African-American men being more likely to be diagnosed and 2.1 times more likely to die from prostate cancer. Access to care and treatment is the primary reason why there is such a disproportionate impact on Black men. And when you consider the racial demographics of the district, it's no wonder why the district has the unfortunate ranking that it does for prostate cancer incidences and death. Prostate cancer screenings are important, and their clinical value has been endorsed by many reputable medical organizations. They allow for the diagnosis of the disease, but when done yearly, it can catch the disease early, allowing for it to be treated when it's less lethal. It also allows a patient to have a conversation with their doctor about their risk and develop an appropriate plan of care for themselves. As of today, it's the best tool we have in our battle against prostate cancer. I introduced this legislation with the support of the entire council and all my council colleagues in an effort to address the high levels of prostate cancer incidence and death that we have seen here in the district. No one should forego a potentially life-saving annual screening simply due to its cost. Lastly, I want to thank Zero Prostate Cancer for their advocacy and their support in helping my office draft this legislation and getting us to this point today. And again, my thanks to you, Chair McDuffie, for holding this hearing and making sure this important conversation is had. And I look forward to working with you on helping this bill move forward. Thank you.
Thank you, Councilmember Allen. I'm going to now turn to our public witnesses before hearing from our government witness. We have Hal Berger, Derek Butts, Robert Vincent Branham, Doc Winston, and Lawson Brooks are the individuals who signed up to provide testimony this morning. Good morning to each of you. Thank you for agreeing to testify this morning. We're going to start first with Hal Berger. You have 3 minutes for your testimony.
Good morning. I'm Hal Berger, a member of Zero Prostate Cancer's government relations team, and I'm here in support of B 25-229. Zero is the leading national nonprofit with the mission to end prostate cancer and help all who are impacted, ranging from financial to emotional support. We also support legislative efforts such as this one to ensure that no one fails to receive the prostate cancer screening they need due to cost. In America, a man is diagnosed with prostate cancer on average every 2 minutes. For men in this country, it is the second most commonly diagnosed cancer, as well as the second leading cause of cancer death. According to the American Cancer Society, and as Councilmember Allen said, this year in DC, there will be 540 new cases of prostate cancer, and 70 men in the district will unfortunately die from this disease. But do not let these seemingly small numbers fool you. Per capita, DC ranks number 6 in the country for prostate cancer incidence and number 1 in the country for prostate cancer death. Prostate cancer does not have to be a death sentence, though. If diagnosed early, the 5-year survival rate is nearly 100%. However, for late-stage prostate cancer, the survival rate is only about 30% for that same 5-year window. Prostate cancer does not operate on a level playing field. Those with a family history of prostate cancer or genetically related cancers such as breast cancer have about twice the risk of prostate cancer compared to the general population. African American men are also nearly twice as likely to be diagnosed with prostate cancer and more than twice as likely to die of the disease. In fact, this is the most significant disparity in all of cancer. For too many individuals, even what we might think of as a minor copay can be a reason not to be screened. This bill, B 25-229, eliminates that cost barrier, making it easier for men to be screened, diagnosed early, and to survive this disease. We will ensure that a man and his doctor are free to make the medical choice that is right for him based on his personal medical history, his risk factors, and his values without having to worry about putting food on the table. September is Prostate Cancer Awareness Month, a month where we in the prostate cancer community spread the message that early detection saves lives. So I urge the committee to pass this bill and help at least save the lives of men in DC. I want to thank Councilmember Allen for his leadership on this issue, and to the chair and members of the committee for the time and consideration of this bill. Thank you.
And thank you for your testimony. Our next witness is Derek Butts. Good morning to you. You have 3 minutes for your testimony.
Good morning, and thank you for the opportunity. My name is Derek Butts. I am the president and co-founder of the Prostate Cancer Awareness Alliance, DMV. We started off in 2020, pretty much just before COVID, just getting the kickoff. As mentioned earlier, with some of the different scenarios and the different statistics pointed out, the high rate incidence of the 540 cases of DC men, the 70 deaths. You're looking at 15% of all the cancers that are actually registered or diagnosed in the state of Washington, DC, and roughly about 7% of the deaths. But what we've been finding is there's roughly about a 60% increase. We've treated and talked to different men, over 3,000 since our inception, through prostate cancer health, prostate cancer awareness sessions, to really kind of help them focus on their prostate health. What we're finding, though, in our talks with these men is a third of them are reluctant to go get screened because they don't have the financial means, they don't have the health care or health insurance. Our organization has been trying to partner with prostate cancer treatment entities like the Howard University Cancer Centers, like the Georgetowns, like the George Washingtons, to really help give back to the community to help serve the underserved. We try to make those connections so they're aware of these screenings, aware of the tests. We're also in alliance with the Zero Cancer, FEN, and some of the other national organizations, National Institutes of Health, when it comes to prostate cancer screening. We feel this is a very important move because of the number of men who are missing out, one, because they don't have access to it, but 2, because the barrier of entry, because of the costs associated with this. We feel it's very important to pass this act, to pass this bill, to allow every single man to be able to come unequivocally and unconditionally get screened and tested for this. As mentioned earlier, it is a silent killer. I am a 7-year survivor. I come from 3 generations of prostate cancer. I was fortunate because I was tracking it and had the means. However, the people that I work with in the underserved communities and work with the culture in general, they don't have those means. For the council to pass this particular measure, to work with the underserved in the DC area, just to the fact of the number of people who are being diagnosed, and COVID had a large spike of that because people were not going to the doctor regularly to be checked out, is going to be important and significant. We hope that you take the measures and take the immediate steps to really look at focusing on what's going to be required to help our men stop dying, be more proactive with their prostate health, but also give them the ability to know and actually go and get those treatment and services, to get that initial screening, just to kind of figure out where they are. Checking their baseline and know exactly where they are with their prostate health is the first step. Making it available so they can do that will be significant and monumental.
And thank you for your testimony. Our next witness is Robert Branham. Good morning to you, Mr. Branham. You can begin your testimony. You have 3 minutes.
Can you hear me?
Yeah,
Okay,
we can hear you. We cannot see you if you want to turn on your camera.
okay. Good morning.
Mr.
Cam-
Branham, we can't see you though. Are you intending to turn on your camera?
Unfortunately, I'm not able to turn on my camera. Good morning, Chairman McDuffie and members of the committee and Councilmember Allen. I am Robert Vincent Branham. I appear before this committee to support Bill 25-0229, the cost-free coverage for prostate cancer screening amendment act of 2023. Chairman McDuffie, Councilmember Allen, this topic is personal to me. This summer, I experienced 3 hospitalizations, which included kidney failure, a heart procedure, and prostate surgery. Had it not been for insurance coverage, I would not have been able to financially sustain my life-saving healthcare on these occasions. Timely healthcare screening is necessary for good healthcare. Financial barriers instituted by insurers should not be a barrier to prostate screening, and they must be eliminated. I urge this committee, this council to approve this bill, and I commend you, Councilmember Allen, and other members for co-sponsoring this bill. Thank you, and thank you.
And thank you for your testimony this morning and for sharing a very personal story, Mr. Branham. We appreciate it. Our next witness is Doc Winston. Good morning to you, and you can begin your testimony.
Thank you, Chairman McDuffie, and thank you, Councilmember Allen, for bringing this important bill for consideration. My name is Dr. Doc Winston. I am representing the Medical Society of DC, where we represent the nearly 11,000 physicians in the district, and where our aim is to be the nation's model for healthcare and physician practice. I am also a urologist in the district, where I take care of men, and particularly men with prostate cancer, for the last 10 years. And I'm a district resident for the last decade. This bill is so important for improving the health of our men in the district. As the other panelists have testified, prostate cancer is experienced very different in the district than other places in the country. We have the highest incidence of prostate cancer in the nation. And we, unfortunately, our men die more often from prostate cancer than anywhere else in the nation, which being the capital, I find that to be a travesty. When I talk to my patients who are experiencing prostate cancer, ask them, like, why have it taken so long to get into see me for their diagnosis? One of the most common variables that we hear is costs, either that they just really couldn't afford to get in for their screening, and that is unacceptable. And this bill provides opportunities to eliminate that barrier, and particularly as stated, this cancer unfortunately impacts African American men very differently than other populations. As Black men, we are about 1.7 times likely to be diagnosed with prostate cancer. And when we are diagnosed with prostate cancer, we're about 2.1 times likely to die from prostate cancer. The research clearly shows that when prostate cancer is caught early and it is caught by the PSA screenings and the digital rectal exam, that the majority of men, including African Americans, will survive nearly 100%, surviving their diagnosis. When it is caught late and that cancer is advanced, that survival rate drops to about 30%, and it's even lower for African American men. This bill will allow the barrier for this screening to be eliminated and will save lives. So I implore the council to consider this bill, pass it, and to begin helping us save lives. Thank you.
And thank you for taking the time to testify this morning. We do appreciate it, Doctor. Our next and final public witness for the panel is Lawson Brooks. Good morning to you. Thank you for joining us this morning. You can begin your testimony. You'll have 3 minutes. You have to unmute. You're still muted.
Thank you. Good morning. I come to you as a 23-year cancer survivor. Prostate cancer is a silent enemy, as we all know, that often goes unnoticed until it's too late. It doesn't discriminate, affects men of all races and backgrounds. However, statistics show, as everyone said this morning, that African-American men like me are at a significantly higher risk of developing prostate cancer. The reasons for these disparities are still being researched, but what is clear is that this malady must be confronted head on. My journey through prostate cancer was easy in comparison to many, thanks to early detection. Opting for surgery just 6 weeks after diagnosis, the prostate gland was successfully removed before any cancerous cells had spread. Moreover, there were no drugs or medications involved in my treatment. When there was an uptick in my PSA after 19 years of undetectable numbers, the recommended radiation treatment was uncomplicated, and I was able to avoid hormone or chemotherapy once again as a result of early intervention. In addition, leading a healthy lifestyle and exercising regularly throughout my life was invaluable in helping me cope with cancer. As a result of my experience, the importance of annual physical exams and knowing and monitoring one's PSA cannot be overstated. Prostate cancer is treatable, especially when detected early. We must encourage all men, especially African-American men, to overcome their aversions and prioritize their health. No one should let fear or procrastination stand in the way of well-being. In closing, I commend this committee for taking up this cause, and I want to express my gratitude to the medical professionals who guided me throughout my journey and for the love and support of my family and friends. I also want to single out Mr. Allen, who is also my council member, for his work on this issue. I also want to emphasize that my story is not unique, rather it's a validation of the power of early detection. So let us all stand together in this fight against prostate cancer by enacting B525-0229, the cost-free coverage for prostate cancer screening amendment act of 2023. It is a choice that can save lives. I have no doubt that early detection and prompt medical attention save mine. Thank you again for your work on this legislation.
And thank you, Lawson Brooks, for your testimony this morning and for also sharing your story. I want to turn to Charles Allen for a round of questions as the introducer of this measure. Mr. Allen?
Thank you very much, Mr. McDuffie. Let me echo my thanks to each of you for sharing your own personal story, your own personal history and personal connection to this legislation. I just want to make sure I lift that up and acknowledge that for being able to speak about that in public. And I think that your advocacy in sharing your own experience and lived experience is part of what helps us as policymakers think about the steps we need to take. So I just want to make sure I acknowledge that and thank each of you for doing that. I was going to start, so largely, I mean, basically we've heard all support for the legislation, which is great. I was going to see if, although I think Dr. Winston may have dropped off. So if he's stepped out, because he literally was joining us, I think from the workplace. So I might turn to maybe Mr. Butts on this. We've heard lots and lots of support. The one pushback that I think exists sometimes out there is if you create an annual screening, there's the potential that it could have medical providers would create procedures that maybe don't need to happen or that could end up being benign. Now, my pushback on that would say, actually what it does is it helps make sure that as individuals, you can have that conversation with your healthcare provider to make an individual decision about what is best for you and for your treatment. But has that come up that you have found in other areas around any criticism? I'm just trying to think through, we've heard lots of support, just trying to always think about where would we see any kind of potential criticism or pushback on something like this?
So thanks for the question. We haven't heard anything of that nature. And as we're dealing with a lot of the different prostate cancer treatment entities in the DMV area, and it's really kind of what we're seeing is the men want to get screened. They don't know where to get screened. As far as the ripple effect of other procedures that may be benign or just not really necessary, we're not really seeing that. Mm-hmm. Our real focus is really helping men to get that initial check to kind of find out where they are. The moderation of checking your health and knowing those numbers. As for my case, I was asymptomatic. So the only reason why I knew there was something going on with my prostate was the fact that I had a PSA. I was doing it annually, and the velocity at which it spread was quick. It went from a 4.32 to literally almost 7 in less than 6 months. And you're not going to know that unless you have that check and that screening and have the ability to have access to that to kind of gauge what's going on. That's sort of like the speedometer in your car. You check it periodically just to see how fast you're going. And you want to be able to do that with your health to see what's going on and what's taking place.
That's excellent. Thank you. I might, Mr. Berger, I can turn to you or Mr. Butts or anybody else who's aware. Would the district be an outlier by passing this legislation? Or are there other states that have put in similar measures? Just kind of want to get a sense of the trend and the norms that are existing out there.
Sure. So thankfully, DC would not be the first to go and pass this type of bill. New York State was the very first to pass this back in 2019. Our neighbor Maryland passes in 2020. Rhode Island passed in 2021, and Illinois passed in 2022. And currently, a very similar bill is sitting on the governor's desk in California. We also have bills which are currently moving through the state legislature in Virginia, in New Jersey, and a few other places as well.
Okay.
If I may,
yes,
if I may add to that, in addition to having it pass in those different states, I'm currently transitioning between the New York and the DMV area. Getting them to actually expose it and make the underserved community aware of it. That's the other part of it. And our organization has helped to really link those prostate cancer treatment entities and services to allow the underserved community to know and bring it to the communities. That's also an important factor. It's one thing to have it passed, but another thing to let people know it exists and actually make them aware of it so you know where to go.
Yeah, that's crucially important. And you kind of anticipated my next question. So maybe I'll see if Mr. Brooks wants to jump in on this. From the American Cancer Society, for example, are there successful examples you've seen of how when we do an expansion of coverage for testing or for treatments, of effective ways that we should be thinking about as a city, how we help communicate to make sure that the awareness is increased so that people are actually able to take advantage of this?
Well, one of the things I've been doing is working. I just started my volunteer work with the American Cancer Society, but I do know there is an interest among a number of churches here within the district to get involved in this. One of the barriers has just been getting within some of these church institutions and making them more aware of the need to have these type of outreach efforts, because it's been my experience there's a real trepidation still among a lot of men to go get tested. And there's an educational component that needs to be in anything that you do. So as you're discussing this legislation, I think the outreach piece is really going to be a real integral part of whatever you do in going forward.
That's good advice. Good advice. I know my time is up. Just Mr. Branham, want to thank you as well. Again, I know you shared your personal story as well. So I know that takes some guts to help share that. So thank you very much for sharing that with us.
Thank you.
And thank you, Councilmember Allen, and I appreciate your questions. I wish Dr. Winston, I know he was taking time out.
Yeah.
It looked like he was at work. And so we definitely don't want to keep him from the work that he's doing. But I would have had an opportunity to ask him a question. Perhaps we can follow up with some questions if you have any, Mr. Allen. But I do want to ask, I don't know if it's anybody who can answer this. One of the things that stood out to me, I think this legislation is pretty straightforward, and I appreciate you introducing this, and not surprised by all the council support for it. But the legislation, I think, is silent on the starting age for screening and instead references evidence-based guidelines. And so one concern I have that we'll look a little bit more into, and perhaps I'll ask this of our government witness who's about to testify, but whether the health insurers are going to understand what's required of them in the absence of any specific sort of ages for when screening should begin. So I just want to put that question out there. I don't know if anybody on the panel has a response to it. I'll certainly ask our government witness to see if the agency has a response to it.
I'd like to respond to that.
Sure, go ahead.
One of the things I know with prostate cancer screening, they usually normally say it should start at, if you're a man over 50, you should start getting screened. However, as an African-American male and having a prostate cancer history, we really recommend the age of 40. The family history is a huge proponent as far as being more likely to get it, no matter when you get it. And I think the legislation, when it's passed and working with the health insurance companies, need to understand, and as the doctors work with their patients, is understand that family history, because that's huge. And a lot of people, what we find, don't ask or don't know their family history. So that's another component we're really trying to help men advocate and understand, and go ask those questions to understand what's going on in your health, in your lineage, when your parental, your maternal side. It doesn't really matter. But I think when you look at that, be realistic in the fact, if you are going to do these screenings and testing, start at a realistic age and not just say, here's a one size fits all, because that's not the case.
No, I appreciate that.
I would agree. If I could piggyback on that real quick, I would agree.
Sure.
I was 47 when I was diagnosed, which was very young. And one of the things, I was uninsured for a period of time working for myself. So I sought out health screenings, and like the first one I went to that I noticed there was an uptick was WJLA at the time, WUSA now. They had a health screening for men, and I happened to go to that. And so I got a PSA done. And that's when I first became aware that I was having an issue. So I would agree that 40 is the best age for an African-American man.
No, I appreciate that. I'm aware of I don't have any risk that I'm aware of or family history. But I recall being told and have friends who have started getting screened around 45, and some of the research said that 45 was the age for Black males. And so I got screened when I turned 45. But I think it may be useful to get some, if there is some consensus in the health community around that specific question of when it should start, just so perhaps there's no confusion or any issues that anyone would have with their insurer with respect to when they get screened. So I appreciate the feedback. I appreciate the testimony. I particularly appreciate the folks sharing their personal stories here today. And thank you for that. We're going to turn now to our government witness for this measure. It's Philip Barlow, who's the Associate Commissioner for Insurance at the Department of Insurance, Securities, and Banking. And Philip Barlow, it's the policy of the committee to swear all its government witnesses in. So if you don't mind standing and raising your right hand. Do you swear or affirm under the penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Thank you very much. Good morning to you. You can begin your testimony.
Thank you. Good morning, Chairperson McDuffie, Councilmember Allen, committee members, staff, and district residents. I'm Philip Barlow, the Associate Commissioner for the Department of Insurance, Securities, and Banking. On behalf of Commissioner Karima Woods, I appreciate the opportunity to testify today on Bill 25-229, the cost-free coverage for prostate cancer screening amendment act of 2023. The department regulates the insurance, securities, banking, and other financial service entities doing business in the District of Columbia. Our mission is threefold. First, to cultivate a regulatory environment that protects consumers and attracts and retains financial service firms to the district. Second, to empower and educate residents on financial matters. And third, to provide financing for small businesses. We accomplish this by regulating the district's financial services industry to ensure district residents have access to a wide variety of financial services, products, and providers. We also work to sustain a district business climate that encourages fair and open competition. Bill 25-229 would provide cost-free coverage of 1 prostate-specific antigen test and digital rectal exam per year. It would also prohibit any health insurer from imposing a deductible, co-insurance, co-payment, or other cost-sharing requirement for prostate cancer screening. Health plans in the District of Columbia have covered prostate cancer screening since at least 2003, when the council passed the Prostate Cancer Screening Insurance Coverage Requirement Act of 2002. Still, according to the Department of Health's 2018 fact sheet, prostate cancer has been the second most diagnosed cancer in the district and the #1 leading cause of cancer deaths in the city, with the incidence, mortality, and survival rates far worse for African-American men in comparison to white men. The department fully supports this bill. The bill clarifies services included in the existing benefit of prostate cancer screening, evidence-based guidelines to include no less than 1 prostate-specific antigen test and digital rectal exam per year. The bill goes further to ensure that these services are provided without cost sharing, seeking to remove any financial barriers that may prevent district residents from accessing these services. Again, the department supports Bill 25-229 and thanks the committee for the opportunity to testify today. I look forward to answering any questions you may have.
Thank you for your testimony this morning. As I mentioned earlier, the bill seems pretty straightforward, but I'm curious as whether or not your office has received any feedback from insurers about the measure.
We did receive some feedback from one insurer. We do actively encourage insurers, and so we just heard from the one insurer, and it was basically the issue that Councilmember Allen raised earlier about maybe overuse of these kind of tests if they are cost-free. But I really think from what I gathered from that, it's really, as I think many speakers today said, that this really encourages and should include a discussion with the person and their doctor to figure out what works best for them given their particular circumstances. And so again, I don't think it was a major objection. I think just wanted to make sure that that's part of the discussion. And again, I think that's been raised multiple times already.
Okay. Did they have any suggestions about how that concern might be addressed?
No.
Okay.
But again, I think it's not really an insurance issue. I think it's really a discussion, make sure that there is a discussion with the provider and ensure that the services are appropriate for each person, again, based on their particular circumstances.
Okay. Are you aware of any other any issues in implementing and enforcing the underlying provision in the measure?
I'm not aware of any. Again, as I mentioned in the testimony, the prostate cancer screening is already covered a requirement for the policies in the district. This just clarifies exactly what that means. So I think that just adds a little bit of extra clarity, but I don't really anticipate and haven't heard any issues raised that would cause any concern.
Okay. I'm not sure if I know you were present in the hearing room, but if you heard the question that I raised about the legislation being silent on the starting age for screenings and instead references evidence-based guidelines. Any thoughts or feedback on whether that language will cause any concerns with insurers or perhaps any confusion as to when people might initially get screened?
That's probably a good question, and it would probably be good to clarify that in the legislation. I mean, I think our position would be that that this requirement is applicable to anybody for whom the test is appropriate. But I imagine that we would likely get feedback. I know it was reported by the insurer who provided information to us that I believe the American College of Physicians recommends testing starting at age 50. So, I don't really anticipate that if somebody were to get this coverage in their 40s, as was discussed, that the insurance companies would try to deny those claims because of that standard. But again, it's probably just helpful to clarify, to take it off of take it out of as an issue.
Okay, we'll do a little bit more digging on this. I appreciate your response there, but I also am mindful that if a Black man, even without a family history, decides that they want to get screened at 40, perhaps there might be some pushback, and perhaps they would have to confront an insurance company that might deny them that. I didn't have any problem getting screened at 45, but we'll do a little bit more digging to see if we can get some clarity around that. I'm going to turn to Councilmember Allen. I don't know if you have any thoughts on that, Councilmember Allen, as the introducer of the measure, but certainly want to work with you and others to address that. But I'll turn to you for your round.
Yeah, thank you very much. And certainly I'm going to turn to that in just a moment. I guess I wanted to make sure, just for the record, Mr. Barlow, as you looked at this, and as we know, several other states have already put in place similar requirements. Are you aware of any adverse impacts from the other states and jurisdictions that have put a similar requirement in place?
I'm not aware of any.
Okay. I really appreciate Mr. McDuffie's question, because I think it's coming from a place of, obviously, how do we make sure that individuals are going to be able to have access to the testing? And so, as a policymaker, how do we guard against, an industry that might push out that date when people need it earlier? The question will be, what's the best and most effective way to kind of get at that protection? So one option is obviously to legislatively put in a date. One idea is to make that the requirement. One idea could be that you're making it a floor. But I know from my experience, one of the reasons why we don't sometimes put specific numbers in legislation and look to the guidelines is that we don't want to have to come back and amend the law every single time a guideline changes. So the way it was drafted, at least, was looking at that from an evidence-based guidelines. Just so that we have it on the record, what are the organizations out there that produce evidence-based guidelines that your agency would be looking at to help determine this?
Again, the only information that I currently have on that is again what was reported to me, that the American College of Physicians recommends starting at age 50. We would have to. This is not the kind of thing that generally comes up in our regulation of insurances. I can only think of one other instance where we refer to outside guidelines for determining what's appropriate insurance coverage. But that's certainly something that we can look at too. And also, of course, we have the ability to address age, for example, in rulemaking, which might be if the decision was to go with a specific age as opposed to a specific source for guidance, then that might be a way to do it, is to have us do it through rulemaking so that it could more easily be changed as the standards change.
Okay. Yeah, I very much want to work with you, Mr. McDuffie, and with all the experts here on how we look at that. I'll note, for example, another organization, the American Urological Society, puts out guidelines in addition to the American Cancer Society. And I think that they do differ a little bit in terms of what age they recommend. So trying to think about how do we help have strong guidelines, we're following evidence-based information, but at the same time, make sure, which is what I think the chair's point is, that we don't have a situation where someone's able to push out beyond what we actually want and need for early testing and early detection. So I think that's really important. So I think that's the only real questions I had. If we don't see adverse impacts from any other states that have done this, I think we got a little bit of work to just kind of fine tune the language around making sure we're protecting folks to get that early treatment or that early testing, to then allow them to make individualized conversation with their healthcare providers and treatment decisions. So I appreciate your testimony and the support of the department, and my thanks to all the public witnesses on this, as well as to you, Mr. McDuffie, for holding this hearing, and I look forward to working with you in the follow-up. So thank you.
Definitely. Thank you, Councilmember Allen, and thank you to Disby, Ms. Barlow, and all the public witnesses who testified on this legislation. We're now going to turn to the next measure on our agenda. It's Bill 25-183, the Society for Science Real Property Tax Exemption Amendment Act of 2023, which was introduced by Councilmember Brooke Pinto on March 2nd, 2023. The bill was referred to the committee on March 7th of this year. It would provide a real property tax exemption for properties located at 1719 N Street Northwest, 1723 N Street Northwest, and 808th Street Northwest, owned by or being sold to Society for Science, Inc. I'm now going to turn to our public witnesses for this measure. We have listed on the agenda Adam Lehman, Mackenzie Becker, I think this is, Victoria Bampo, Maya Ajmira, I think it's pronounced, and Gary Goodweather. And we have one person testifying in person. We're going to start with you. Good morning. Thanks for joining us in person. You can begin your testimony. You'll have 3 minutes.
Including for the property they are purchasing from Hillel at 808th Street Northwest. Hillel was founded in 1923 to provide Jewish students on college and university campuses with a safe and welcoming space in which to further develop their Jewish identities, engage in Jewish life experiences, and serve the broader campus community and world. Hillel today serves more than 170,000 students with presence on 850 campuses in North America and 14 other countries around the world, including several campuses right here in the District of Columbia. Hillel International has maintained a headquarters presence in Washington, D.C. for decades, and we intend to maintain that presence. At the same time, given our changing real estate needs, we determined it is in our best interest to sell the property we own at 808th Street Northwest to Society for Science and to relocate to a different property in the district. Hillel strongly supports Society for Science's need for a tax exemption We believe that an organization like Society for Science is needed in the district, and we're aligned with their mission to expand scientific literacy, effective STEM education, and scientific research. They will make excellent use of the building at 800 8th Street Northwest, expanding their programmatic offerings, and this will keep them in the district so they can positively impact students and teachers here for years to come. However, those plans would be thwarted if the council does not grant this tax exemption. As you may be aware, their bank's commitment to lend funds for this purchase is reliant upon the tax exemption, as is our contract to sell the building to them. I will not, with limited time, go over the many programs they offer that are beneficial. I will just say that already those programs have generated millions of dollars in revenue for the city over the past 82 years and benefited many thousands of students, teachers, and community members during that time. I am confident that with the tax exemption, Society for Science will create more jobs and make improvements otherwise in the district. And the money they save on the tax exemption is going to be invested right back into the district. I want to close by urging the council to move forward with this exemption so that we can conclude the transaction favorably. Thank you very much.
And thank you for your testimony this morning. Our next witness is Victoria Bampo. Good morning to you. Begin your testimony.
Good morning, Council Member McDuffie. My name is Victoria Bampo, and I'm a professor of chemistry at Bard High School, Early College, DC in Ward 8. I am here to express my support to the Society of Science and ask the Council to amend Chapter 10 of Title 47 of the District of Columbia Official Code to provide a property tax exemption for the Society for Science's properties located at 1719 and 1723 N Street Northwest, as well as the property they are purchasing at 800 8th Street Northwest. The society has had a strong and positive impact on my development as a teacher and as well as my students. I would love for the Society for Science to be able to expand its offering in the city through the purchase of the building at 800 Street Northwest and this tax exemption. Without the exemption, we fear that the society will take its offerings and programming outside of this city. For over 6 years, I have received monthly news journals from the Society of Science, attended conferences and received materials and science kits. I have been rated a highly effective teacher in both Baltimore and DC public schools because of the resources from the society that I use in my classroom and school. It has made science more accessible to my students. The most remarkable resource I received from the society was during the COVID-19 pandemic during 2020-2021 academic year, when I received STEM research lab kits for all my students through their STEM research grant. This made it possible for my students to conduct simple chemistry experiments from home, although we had virtual classes. This was a huge help, and some of those kits were used in the subsequent years. Furthermore, I also assign reading assignments from the science news magazines. This helps students to make connections between some seemingly irrelevant topics that we discuss in class to real life situations. The stories are interesting. The students enjoy the reading assignments. Copies of the magazines are also shared with the entire school through the library. The scientific literature provided by the society also led to many student discussions on diverse STEM careers. The Society for Science has greatly helped me to teach science effectively, as well as increase scientific knowledge and access to my students in the district. I hope the council supports the society and its plans to expand its offering and obtain critical tax exemption. The district and the residents cannot afford to lose a resource like the society. Thank you for the opportunity to testify.
And thank you for taking the time to testify. We really appreciate your testimony. It helps supplement the record. Our next witness is Maya Ajmera. Good morning to you. Thanks for joining us virtually. You can begin your testimony. You're still muted.
Sorry. My apologies. Good morning, Council Member McDuffie. My name is Maya Ajmera, President and CEO of the Society for Science, Executive Publisher of Science News, and a longtime Ward 6 resident. We are a nonprofit organization whose purpose is to promote the public's understanding and appreciation of science. Our headquarters is located in Washington, D.C. at 1719 N Street Northwest and 1723 N Street Northwest. Society for Science has been dedicated to expanding scientific literacy, access to STEM education, and scientific research for more than 100 years in our nation's capital. We seek to promote the understanding and appreciation of science and the vital role it plays in human advancement, to inform, educate, and inspire. We are best known for our award-winning magazine, Science News, our world-class science research competitions for young people, and our suite of outreach and equity STEM programs, which we are proud to provide to the students and teachers of DCPS and DC charter schools. I'm here on behalf of the Society to request that the District of Columbia provide real property tax exemption for properties located at 1719 N Street Northwest, 1723 N Street Northwest, and 800 8th Street Northwest to help the Society complete its acquisition, redevelopment, renovation, and equipping of new headquarters buildings that will be located at 800 8th Street Northwest. The tax exemption is necessary for the Society to continue its long-standing presence in the district. Without this exemption, it will be impossible for the Society to purchase its new building and expand its offerings, especially with the lack of viable funds available due to donor restrictions. For more than 100 years, the Society has been headquartered in the district, and in that time, we have provided hundreds of thousands of students from Washington, D.C., the United States, and abroad the opportunity to participate in our programs and science research competitions for young people. Those competitions include the Science Talent Search, the nation's oldest and most prestigious science and math competition for high school seniors, which was launched by the Society and first sponsored in 1942 by Westinghouse, and today sponsored by Regeneron, as well as the Thermo Fisher Scientific Junior Innovators Challenge, the country's premier middle school STEM competition, which is launched more than 2 decades ago. Both competitions are hosted annually in the district. Additionally, the Society holds annual conferences for middle and high school STEM teachers, as well as an annual advocate institute for mentorship of underserved students in the district, along with a variety of other affiliate meetings. Currently, the district is in a precarious position regarding STEM access for district students and teachers as compared to 5 years ago. Due to the lack of programming and dedicated STEM spaces, with the exception of the Smithsonian Institution, the Society is the only DC organization focused on providing scientific learning opportunities for DC teachers and students. By approving the tax exemption, the Council will underpin our mission of promoting the public's understanding and appreciation of science by providing a modern new headquarters buildings that will not only facilitate the technology and amenities to allow us to continue to grow and improve our programs and competitions, but
If you wanna
also to create a STEM
summarize
innovation
your
hub.
testimony, your time.
One
is
more
up.
minute. One
Well,
more
Actually,
minute.
we have another bill after this with other witnesses, and so I want
Okay.
to be mindful of everybody's time. If you want to, what I'll do is I'm going to have a couple of questions for you. If you want to summarize any points you missed, and obviously we're going to incorporate your written testimony into the record. But I wanted to ask about the bond issuance. You all had a industrial revenue bond project last year, and I recall we approved, I think it was up to $25 million in tax exempt revenue bonds for the acquisition, redevelopment, renovation, and equipping of a new headquarters building located at 800 8th Street Northwest. And I was curious as whether or not you all had the opportunity to close on that bond issuance.
Are you asking me?
That's a question for you. Yep.
No, not at this point.
Okay. Okay. And I know we still have Gary Goodweather. Are you intending to also provide testimony or answer questions?
Yes.
I'd like to provide testimony.
Okay. All right. Well, I'll give you, good morning to you, and you can begin your testimony. You have 3 minutes.
Thank you. Good morning, Chairperson McDuffie. My name is Gary Goodleather. I am the managing principal of GME Investments and live in Ward 2 with my wife and children. GME Investments is a Washington, D.C. based real estate investment advisory firm. I'm here on behalf of the Society for Science to discuss the project at 800 8th Street Northwest and the financial necessity of the real estate tax exemption for the society. The 800 8th Street Northwest property is an existing 9-story building measuring 34,194 square feet above grade and 2 levels of underground parking of 10,548 square feet for a total of 44,742 square feet. Hillel International has occupied the building since it delivered in 2001. In order to properly occupy the space and expand their scientific offerings, the Society will need to complete extensive renovations to the property. Society for Science has already obtained Board of Zoning Adjustment approval to convert the first of 2 parking levels to office use, and they have agreed to certain associated proffers. The parking level 1 conversion is for the construction of a scientific innovation center. The intent is to connect the innovation level to the ground floor and extend activities out onto 8th Street. The ground level will also include showcase space for science projects that will further connect DC residents and visitors to the center and further activate 8th Street. The total redevelopment of 800 8th Street Northwest is projected to cost $30 million. The Society for Science is purchasing the building for $15,950,000 and construction costs are estimated at $10 million. The building is anticipated to receive all new energy efficient systems and meet DC's new green building standards, keeping in line with the district's sustainability goals. Additional green certifications are under consideration. Architecture and engineering costs are approximately $900,000. Additionally, we have preliminarily selected a Washington, D.C. certified business enterprise and woman business owned to design the renovations. Cost of fixtures, furniture, and equipment are budgeted $800,000. Financing costs, capitalized interest, and so forth are $3.3 million. Society for Science anticipates, subject to the tax exemption closing on the property in December, the current timeline, depending on the preparation of plans and permits to occupy the building by the end of early 24 or early 25. The Society desires to move its new headquarters in as soon as possible so that they can have a modern home for its staff, initiate new programs and further scientific work for the public and society as a whole. The tax abatement for Society for Science is a necessity to perform on the redevelopment of the building and continue to operate indefinitely. The society is funded through programs of fees and competitions. However, a significant amount of the revenue is restricted as direct grants to students and for operations of the events themselves. Finally,
your time has expired, Mr. Goodweather, and
thank
so
you.
I
hope
do have.
Appreciate it. Hope the council considers it approval.
I appreciate your testimony this morning. I appreciate the testimony of each of the witnesses this morning. I'm not sure who's the best person to answer the question. Maybe I'll toss it out. And Maya, Ajmer, you can decide whether you want to answer to somebody else who you'd like to toss it to. But the Office of the Chief Financial Officer does tax abatement financial analysis on these types of measures. And in this case, the TAFA analysis said that this was not financially necessary. And so I wanted to at least just hear your response to that conclusion drawn by the Office of the Chief Financial Officer.
Gary, would you like to take that?
Sure, thank you. First of all, just 2 quick notes on that. The 2022 financial statements had not been submitted to the Office of Chief Financial Officer at the time. And also it's noted in the TAFA that the impact once the society acquires 800 8th Street Northwest on its operations had not been considered yet. Effectively, in 2022, the society realized a $16 million net loss in change in net assets, including operating loss of $12.8 million. There's the financial necessity both from an ongoing operation standpoint, but also our lenders, require that We meet certain loan covenants and maintain certain liquidity, and we cannot do that without the real estate tax exemption.
Okay, I appreciate you putting that on the record. I think it is important for the record and consideration of members of the committee. I don't have any additional questions. Maya, Ajmer, is there anything else you wanted to add to the record? I know I cut your testimony short, but we do have the written testimony. Anything else you wanted to add before I
Yeah.
transition to our government witness?
I do. I just want to say, Councilmember McDuffie, how extraordinarily important this tax exemption is for the Society for Science. We want to be in downtown Washington, D.C. This is a community development project. Our vision is, for this headquarters is a place where students, teachers, scientists, and the public in the district can come to tinker, to learn, and to build a vibrant STEM community. I just have these grand visions of students coming into our STEM Innovation Hub to tinker in the makerspace. I envision DC public school teachers being invited to one of our national conferences on learning how to build a STEM research program. And I can see the Washington, DC Science Fair, which no longer exists anymore in Washington, DC, in our headquarters, with students, teachers, and public mingling with one another. I just envision a place where there are public lectures that are happening of our great scientists and engineers of our cities and talking to the public. We will fill a big void. You will help us fill a big void in our nation's capital by giving us a place to fulfill not only our national work, but to go much deeper in our own backyard. Thank you for your consideration.
And thank you for your time and testimony, each of you. Next is our government witness. Nancy Fox is a senior policy analyst with the Office of the Finance and Treasury within the Office of the Chief Financial Officer. I understand, Nancy Fox, that you are not joining us in person.
I'm here. I'm
Virtually?
here remotely.
Okay, all right, you can begin your testimony.
Great, thank you. Good morning, Chairman McDuffie and members of the Committee on Business and Economic Development. I am Nancy Fox, Senior Policy Analyst in the Office of Finance and Treasury for the Office of the Chief Financial Officer, the OCFO. I am pleased to testify for the OCFO on Bill 25183, the Society for Science Real Property Tax Exemption Amendment Act of 2023. The Society for Science, we'll call them, refer to them as a society in the testimony, is a nonprofit organization dedicated to expanding scientific literacy, STEM education, and scientific research. The bill will exempt real property tax on 3 properties, 1719 and 1723 N Street Northwest, known for tax and assessment purposes as lots 62 and 802 and square 158, respectively. We'll refer to these as the N Street properties. And also 800 8th Street Northwest, known for tax and assessment purposes as lot 31 and square 404. This is the 8th Street property. The N Street properties, as you've heard, is currently operated as the headquarters of the society. The applicant is the contract purchaser of the 8th Street property. Once purchased, the society intends to undertake a large-scale renovation of the 8th Street property. The purchase and renovation will allow the society to house programming and meetings within its own space and to consolidate its office space. Excuse me. After completion of the renovation, the society plans to offer the N Street properties for sale. According to the society, the relocation and renovation for the 8th Street property will allow for an expansion of its activities and furthering of its mission to expand science, literacy, education, and research. The exemption in the bill stays in effect on the 3 properties as long as they are owned and used by the society. The bill does not provide an exemption from real property transfer or deed recordation taxes associated with these properties. The OCFO's Office of Finance and Treasury evaluated the society's audited financial statements for 2019 through 2022, as well as information provided by the applicant pertaining to the planned purchase, renovation, financing, and operation of its new headquarters in the 8th Street property. The society, as you've heard, intends to finance approximately $20 million of the project with debt and contribute the remaining amount with available cash. The society provided a commitment letter from its preferred lender to finance up to $20 million of the project's cost. The financing requires the society to maintain a level of financial assets free of donor restrictions, known as a liquidity requirement, as long as the debt is outstanding. The financing also requires during the term of the financing that the society demonstrate it has sufficient revenue net of expenses, known as a debt service coverage ratio. Based on the society's current level of unrestricted net assets and the growth trend in unrestricted net revenues over the period evaluated, the society can be expected to meet the lender's requirements while also making its cash contribution to the cost of the purchase and renovation. Therefore, the exemption for the 3 properties is not financially necessary. The society's financial statements demonstrate a strong financial position, and the total real property tax burden is a small portion of its overall annual expenses. However, the society's financial resources can fluctuate due to changes in the amount of grant funding available, expenses, as well as the value of its investments. The society may decide, without the reduction in expenses provided by a real property tax exemption, that it does not want to execute the purchase and financing of the 8th Street property. The purchase and sale agreement for the 8th Street property includes a provision which would allow the society to withdraw from the purchase if the exemption is not granted. If the society does not follow through on its planned purchase and renovation, the benefits of the project to the district described by the society may not occur. While a separate fiscal impact statement will be prepared, the estimated value of the exemption is approximately $1.85 million during the current financial plan period. An additional $10.94 million is the estimated value of the exemption for 25 years subsequent to the financial period. Thank you for the opportunity to testify. This concludes my testimony, and I'm happy to answer any questions you may have at this time.
Thank you for your testimony. We appreciate it. I just want to clarify the last point you made. The total estimated value of the tax abatement in the financial plan is what amount?
During the financial plan period, approximately $1.85 million.
Okay, and then overall, I think through fiscal years 28 through 52?
10.94 million additional.
Okay, and the total that you all have outlined in the tax abatement financial analysis is how much?
Let me pull that up.
Well,
in addition to those two numbers, it should add up to
I have $12,793,000.
Yes, correct.
And about, okay. Is there any other information that you don't have that you would need for any further consideration of this measure? It is pretty straightforward, and I really appreciate the testimony of the witnesses articulating their need for this abatement. But is there any other information your office needs on this measure?
No, the society, the representatives provided a lot of information that was very useful to us in doing the analysis.
Okay, all right. Well, I want to thank you and all the other witnesses who testified on this measure. I don't have any additional questions. If we do, I think there's a need for any follow-up. We'll be sure to reach out. All right, thank you.
Thank you.
The final measure on our agenda is Bill 25-428. I, along with Councilmember Christina Henderson, introduced this measure, the Kappa Alpha Psi Fraternity Inc. Real Property Tax Exemption Act of 2023 on July 13th of this year, and the bill was referred to the committee on September 19th. The bill would provide for a real property tax exemption for property located at 1708 S Street Northwest in lot 813 square 0154, owned by Kappa Alpha Psi Fraternity Inc. I'm now going to turn to our public witness on this measure. I believe we have 5 people who have some testimony, but that maybe one is testifying. I'll mention all the names because I appreciate you all taking the time this morning. Michael Greer, Donald Greenwood, Carl Stewart, David Hardwick, and Brandon Craddock. Good morning to each of you. It's good to see you. I think you're going to decide who's going to testify this morning.
Can you hear me?
Yes.
Yes, excellent. We will have a panel of 6, and we will be very expeditious. Councilmember Reed, thank you for the opportunity to testify. My name is Michael.
Let me ask you, are all 6 of you testifying, or is it, I understand that only a couple of you are actually testifying?
We were going to be very quick in our testimony.
Oh, go ahead. Okay, gotcha. All right, thank you.
So my name is Michael Greer. I'm a member of Kappa Alpha Psi Fraternity Incorporated, of the Washington DC Alumni Chapter. I'm excited and appreciate the opportunity to testify. I just want to take a moment and speak to the work that we do for our seniors here in the community. We represent and support our senior brothers and make sure that they stay connected in the community and really stress that they have a place in the Kappa House so that we can do the intergenerational work so that members can continue to grow and prosper from the learnings and experiences of those that came before them. I'm a proud member of this fraternity, and I request that, excuse me, I ask that you support the tax abatement and that the council as a whole support the tax abatement. Thank you.
Thank you, Mr. Greer. Appreciate it.
Good morning, I'm Donald Greenwood, Vice Chairman of our Capital League Mentoring Program, which won an Eastern Province Chapter of the Year award last year. I'm a 60-year resident of DC. We traditionally serve 60+ kids in our historic Capital House with our Capital League. But last year we moved into DC's Condoza Middle School, and this year we will move into Monumental Academy as well. We look forward to continuing our services within the city. Thank you for the opportunity to testify.
And thank you for taking the time to testify, Mr. Greenwood. Next.
Good morning. My name is Carl Stewart. I'm a 22-year resident of Washington, D.C. I am the current president of the historic Kappa House Restoration Foundation. The foundation was actually founded in D.C. in 2004. And the purpose of the foundation is to provide charitable and educational purposes to restore and preserve and maintain the public view and appreciation of the historic Kappa House located here at 1708 S Street in Washington, D.C. Our documents have been submitted, and we look forward to hosting you once the construction project is completed. We're now hoping to be able to complete the project to support our elderly and our DC Kappa Leaguers once the construction is completed. Thank you.
Perfect. Thank you for your testimony, Mr. Hardwick. Or Mr. Stewart, I should have said.
Good morning. My name is David Hardwick, and I am a member of Washington, D.C. Alumni Chapter, and I've been acting with this chapter since 1977. In the 75 years that we've been in this facility, it's been a great wealth of contributions, not only to the citizens of the city, but also across the country. We supported Hurricane Katrina relief, folks in New Orleans and the Louisiana area. We also provided excellent services across the board in every ward of the city. We want to continue to do that, and we want to be able to do that at an affordable rate at our current facility here at 1708 S Street. And I think that we need this abatement to help us continue that service. Thank you.
Thank you so much for your testimony this morning, Mr. Hardwick.
Hello, can you hear me?
Yep, we can hear you.
Hello, my name is David Whittington, and I am a senior attending Capital City Public Charter School with a 3.7 GPA. I am a member of the Washington, D.C. Capital League. I'm here because I want Capital League to continue and for it to get larger with students like me with a nicer building. Capital League helps young men like me grow to become leaders. This is a great program that teaches life lessons, such as how to debate, how to give an elevator pitch, how to manage money, how to dress and eat properly while dining, and most importantly, how to interact with the police when being pulled over or aside on the street. And we perform community service throughout the city. Supporting my journey throughout life, I look at these brothers like they're my uncles and mentors, because they always support the things that I would like to pursue. They support my athletic career by putting me in touch with coaches and trainers to help me prepare for the upcoming season. They also provide mentoring for college, which is a big help because I'm a senior and I plan to attend college. Capital League is a big loving family, and I'm very happy to be a member. I'm also a member of other youth organizations, and they do not have a space like Capital League. We go to different spots around the city but it gets really confusing when the programs host events all over the city. My other organizations use school or recreational centers that aren't open late or during the weekend, but not Kappa League. We meet at the historic Kappa House. And the events are during the weekend or when after-school activities have ended, which is convenient for me with all that I have going on. Keeping the Kappa House will not only be important to the brothers, but also to me, because this is a space that gives youth like me a safe space to come and talk about life and build lifelong bonds with other Black males. Thank you for your time.
I'm really pleased that they gave you the opportunity to testify. It was great testimony. You did a great job. You look great. Give me your name one more time, loudly and clearly, so that the record can reflect it.
My name is David Whittington.
David Williams?
Whittington,
Okay. And what school do you attend?
Capital City Public Charter School.
Excellent, excellent. Thank you for taking the time to testify. We really appreciate it.
Thank you for giving me the time.
And good morning, Chairperson McDuffie. Pleasure to see you as always, and members of the committee. My name is Brandon Crowder. I serve as the Polemark President of the Washington, D.C. Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. Chartered October 15, 1924, our chapter stands as a beacon of history, a model of service, and a molder of the future of this city. As we prepare to enter our centennial, I can't help but to reflect on my ties to this chapter and to this city. Our fraternity house, located at 1708 S Street, was purchased in 1949, and my grandfather, who was initiated into our fraternity at Howard University, was one of the first lines to be initiated in this house. I grew up in the Logan Circle Shaw neighborhood, having lived on 4 Logan Circle Northwest, 1305 P Street Northwest, and 1319 Bridge Street Northwest. From the 70s through the new millennium, that was my home, and I still call it. I used to play basketball at Stanton Shaw and go to Hardee's for lunch, which was located beneath the CBS of 17th and P Street Northwest. I am a 3rd generation Kappa. My family has been in DC for 8 generations. So I have deep roots to the city and this fraternity. I'm privileged to be the 48th Polemark of this chapter and to lead 300 dedicated men to this fraternity, this city, and our shared future. Kappa Alpha Psi is Black history. Washington Alumni Chapter is Black history. We are makers of Black history. Our chapter has been home to mayors, council members, teachers, preachers, police, firefighters, businessmen, the host of others that create the fabric of the city. As we continue to grow, we know gentrification has changed this city, but it can't change Kappa, it won't change our chapter. We are committed to every ward of this city and the people who build this city every day through hard work, determination, and grit. We must continue to be the home for the pillars of our community and a sanctuary for its future. This is why I humbly ask you, Chairperson McDuffie, members of the committee, and the DC Council to vote for the Kappa Alpha Psi real property tax abatement. We will and we must continue our work across the city for the next 100 years and continue to be a flagship for men and boys across the city to follow. Our work creates new pathways to prosperity for babies who are bonded to a future DC. A few moments ago, you heard from Dave Whittington, a model Kappa leaguer and Washingtonian with a bright future after college. Supporting this young man, hundreds more over the years, is our charge that we take seriously and unwavering in our commitment. Through the tax abatement, you will preserve an updated space for young men like David and allow us to continue to grow and expand our Kappa League that builds young men to be leaders in their lives and most importantly, this city. When young men graduate from Kappa League, they not only have new skills, but they have the confidence to reshape the world around them and to network to support them and the next stage of their life. I'm proud to say we have a 95% college placement among Kappa Leaguers that 100% leave with plans for their future. This council support will change lives and continue to guide the city in the right direction. As you may have heard, our motto is achievement in every field of human endeavor. Brothers across generations share ideas and convictions that move our city forward in the historic Kappa House. We support brothers in their lowest of lows and their highest of highs, and remain a steady source of support for brothers when their families may have departed. Through our social activities, we support senior brothers and senior members of the community and continue to ensure their knowledge, experience, and expertise does not go to waste. Diverse brothers from all backgrounds converge at the Kappa House and hope.
Mr. Braddock,
I'm sorry.
I'm not sure if you heard that, but the time has expired. I wanted to tell you that I really appreciate you all lining up those witnesses. I think you all did a great job of talking about the philanthropic work of the organization, all the service related work that you all do. And I think it was really, really great that you have David there to testify as well. So if you have some closing summary, you can do that. I don't have any questions for you all. I think we've interacted, my team, the committee has interacted with you all a great deal on this. The Office of the Chief Financial Officer actually returned a favorable tax abatement financial analysis on this measure. So I don't have any questions. If there's any summary remarks you have before we get to the government witness.
No, in closing, I'm just going to ask for your support in making this hope a reality. Taking the first step in this legislation before you. I would also like to thank my political and social action chairman, also my ANC, Brother Gordon Fletcher, for this opportunity. And although you stated there are no questions, but if there are any, we are here to answer. Thank you.
Appreciate it. It's good to see you, Ms. Craddock, and appreciate you giving Mr. Fletcher a worthy recognition on his efforts to make this happen today as well. So thank you for your testimony, each of you. We're going to turn next to our final witness on the agenda, Rick Liu, who's a senior policy analyst with the Office of Finance and Treasury within the Office of the Chief Financial Officer. I don't see Rick Liu present, is he? Oh, are you joining us virtually?
I'm joining you virtually, yes.
Okay. Good morning to you. You can begin your testimony. Oh, actually, let me swear you in. I forgot. Let me do that. That is the new policy that we have here. It's not so new in our 9th month. But if you could raise your right hand, do you swear or affirm on the penalty of law that the testimony you're about to provide to the Council of the District of Columbia in this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you very much. You begin your testimony.
Good morning, Chairman McDuffie and members of the Committee on the Business and Economic Development. I'm Rick Liu, Senior Policy Analyst in the Office of the Chief Financial Officer's Office of Finance and Treasury, or OCFO. I am pleased to testify for the OCFO on Bill 250428, the Kappa Alpha Psi Fraternity, Inc. Real Property Tax Exemption Act of 2023, or known as the bill. The bill will provide a real property tax exemption to the property of the Washington, D.C. alumni chapter of the Kappa Alpha Psi fraternity, known as the applicant, located in the DuPont Circle neighborhood with an address of 1708 S Street Northwest, known for tax assessment purposes as Lot 813, Square 154, are known as the property. The bill will exempt the property from real property tax for the 10-year period between January 1st, 2024 to January 1st, 2034, provided that the applicant continues to own it. The applicant is the Washington, D.C. chapter of the Kappa Alpha Psi fraternity, which is the nation's second oldest existing collegiate historically Black Greek letter fraternity. The applicant has owned the historic Georgian-style 4-story row house property since 1948 and uses it currently to carry out organizational activities such as member meetings, hosting public events, and support space for community services. They now plan to undertake the first major renovation of the property since it was purchased. The renovation will address a wide range of capital improvements and deferred repairs, many of which are deemed essential, such as life safety and accessibility upgrades, code compliance improvements, and building equipment replacements. While a historic preservation grant and additional member donations funded the initial renovation of the upper floor conference rooms, the majority of the capital renovation program remains unfunded. The applicant seeks to fund their major renovation using annual revenue retained from the 10-year tax exemption, along with complementary one-time donations and grants. The applicant is organized as a social club exempt from federal income tax under Section 501c7 of the Internal Revenue Code and is ineligible for an administrative tax exemption under district rules. The OCFO reviewed the applicant's non-audited financial statements over its past 3 fiscal years, FY 2020, 2021, and 2022, and year-to-date FY 2023, as well as cost estimates for the renovation items. Information provided indicates that the applicant's primary source of revenue to cover operating costs is membership dues, which comprise up to 85% of its annual revenues in past years, while supplementary revenue sources such as fundraising events or annual member contributions generally cover activity-specific costs but do not generate a significant surplus. With the exception of FY 2020, the applicant's financial statements indicate they are essentially breaking even with operating costs slightly exceeding its revenues in FY 21 and 2022. Furthermore, despite possessing significant equity in the property, the applicant's lack of net income also makes it a challenge to obtain debt or a commercial equity line of credit to finance a renovation, since there is insufficient income to cover debt payments. For these reasons, OCFO finds that the real property tax exemption provided in the bill is financially necessary for the applicant to help cover capital improvements and repairs on the property that would enable safe and cost-effective operations in the long term. While a separate fiscal impact statement will be prepared, the estimated value of the exemption is $178,000 during the financial plan period and an additional $352,000 for the 6 years following the financial plan period. For ease of administration, we recommend amending the bill to change the term of its 10-year real property tax exemption to align with the district's tax year, beginning and ending October 1st, instead of a calendar year as it's currently written. Thank you for the opportunity to testify. This concludes my testimony, and I'm happy to answer any questions you have at this time.
And thank you for your testimony this morning. We just a couple of questions about this. In your testimony, you stated that the applicant is organized as a social club under the Internal Revenue Code Section 501(c)(7), and thus is ineligible for an administrative tax exemption. Can you unpack that a bit and why that's significant?
Because they're not, unlike some IO 501(c)(3), tax codes or organizations, there is the 501(c)(7) is specifically excluded under district regulations from an administrative tax exemption, which we presume is why they are, requesting this TAFA.
Thank you for that. And just to be clear, district-oriented nonprofit organizations organized under Section 501(c)(3) would be eligible for an administrative tax exemption. Is that correct?
I believe Basil is on to sort of confirm. I don't know if all of them are, but we do know 501(c)(7) are specifically excluded.
Okay. Do you I don't mean to put you on the spot with the question necessarily, but is Basil on? Do you want to answer that question, or is that something you want to follow up with us about?
Well, I'm here. I'm happy to respond if you want.
Sure.
And as you pointed out, yes, a district focus, that is an organization whose activities have a principal impact in the District of Columbia on the public in the district, that is organized as a 501(c)(3) charity, can qualify for an administrative exemption from the real property tax. But a social club that meets the IRC Internal Revenue Code requirements under 501(c)(7) is not that type of an organization, and it's not entitled to an exemption under any of the existing categories of our tax exemption law.
And thank you for clarifying that. Let me ask one final question, just to clarify for the record. Rick, Lou, the tax abatement financial analysis, actually probably two-part, but just to be clear, the TAF analysis for this measure is favorable, correct?
Yes, it is financially necessary, is our opinion.
Financially necessary is the key phrase, but it wouldn't cover the total cost of the renovation. Can you give the difference or the delta that would be remaining, given the amount of the tax abatement and the total cost that you understand for the projected expenses?
Sure. So the proposed tax exemption, the full amount, through the 10-year period, is estimated to be 529,000. The actual remaining cost of the project with related expenses is about 663,000. So, there would be a delta of about, 130,000 there. Now, I will also say that it's, this tax exemption currently reflects a commercial tax assessment, not a mixed use one, which is higher than it currently exists. That may be changed in the future, but suffice to say, there would be a gap in between, regardless, between the tax exemption and the project related sort of costs that we've been told they would pursue sort of grants and potential additional member donations to make it more feasible.
Thanks for that clarification. I don't have any additional questions. Is there anything else that you would like to add to the record before we adjourn?
There is not.
Well, thank you so much for your testimony. I want to thank all the witnesses on each of the three measures that the committee considered this morning. As a reminder, those interested in submitting written testimony for the record may do so until Thursday, October 5th at 5 p.m. Submissions should be uploaded via the new hearing management system on the council website at dccouncil.gov, dccouncil.gov. There being no further business before the committee, this marks the end of today's public hearing. The time is now 11:37 a.m. and this hearing is adjourned.